if we are already fully vaccinated, as we still can get infected and even infect others with COVID-19, even if we are already fully vaccinated or have had booster doses. So thank you very much and a good day ahead of you for all of you. Thank you. Over to you. Jazz.
Thank you so much, Yusek Verheri, for the presentation. We will now be moving forward to our next presentation for this morning to give us a presentation regarding the National Vaccination Operations Center guidelines on the implementation of COVID-19 booster shots. We have Director Mirna Kabutahe. Yusek Mirna C. Kabutahe, our Undersecretary of Health for FICT. Yusek Mirna, turn over to you.
Thank you, Jazz. Magandang umaga po sa inyong lahat, kay Yusek Rosette, our experts, and all our bayani, yung ating mga healthcare workers. We will present to you the highlights of the guidelines for the booster doses. Can I have my slide, please? To priority group A1, essential workers in healthcare services, having heard the rationale and sequence of events that happened, leading to this phased implementation, starting with our booster from Yusek Rosette. We have formed the guidelines, and we would like to thank all those who have worked very hard the whole day yesterday. The team of Yusek Rosette, the team of the Office of the Secretary, my team, who have worked very hard, and all those who have been involved. Next slide, please. To come up with this policy, the department memorandum on the interim operational guidelines on the administration of COVID-19 vaccine booster doses to priority group A1. These are the essential workers in the frontline health services, which is A.1 to A 1.1 to A1.7, and you can download in the different links that will be provided. As a complement to the DM, we have a circular to reiterate to the other different line agencies and those who are involved in the COVID-19 vaccination. We have a department circular. Next slide, please. So the guidelines start with definition of terms. You already know a booster. This is the doses administered to a vaccinated population that has completed a primary vaccination series, and the booster is a single dose, no? Many are asking, do we need to have 2 booster doses parang sa primary? No, the booster dose is only 1 dose. And Yusek Rosette has explained what is a heterologous dose and what is a homologous dose. Homologous, same vaccine series, heterologous, and there's a different brand from the primary series. And what is a primary vaccination dose series? The 2 dose of a 2-dose series or a 1 dose of the Janssen vaccine. Next slide, please. So our priority group, this is the phase 1, is our essential workers in frontline. This is the A1.1 to A1.7. So a single COVID-19 booster dose. And the following will be given as booster doses. Pfizer, Moderna, Sinovac, and AstraZeneca. Next slide, please. Yusek Rosette has already presented the recommended booster dose combination for priority based on the approved EUA from FDA. No? So we have our primary vaccination series. All of them are 2 dose except Janssen na 1 dose. Our interval for booster is at least 6 months from the end of the primary vaccination. So if it's a 2-dose series, then the 6 months from the second dose. for all the 5 doses, 5 brands of vaccine, and for Janssen at least 3 months. And homologous booster has been approved by FDA for these 4 vaccines, and heterologous booster also approved on the last column, and this has been explained extensively earlier. Next slide, please. This is also to reiterate that the priority group A1 shall be given the option to choose what vaccine, and this is the reason for the town hall today, so that for all of you who have already made up their minds, you can be further enlightened. For those who have not yet made up their mind, then you can be helped to choose what are your options. But it will depend on the availability of the vaccine brands in the vaccination site, so that we do not have too much problem in terms of the logistics management. No? And the volumes that will be administered are the regular doses for Pfizer, Sinovac, and AstraZeneca. But the EUA from FDA states that for Moderna COVID-19 vaccine as booster, we will only need half of the regular dose. So it will be 0.25 ml instead of the regular 0.5 ml. Next slide, please. The rollout starts today after the EUA has been approved. This is in consideration for the clamor of our healthcare workers that they be given booster shots. As the Secretary of Health was saying, we do not only boost their health, we also boost their morale by really taking care of those who are due for the boosters. And this starts today for those who are ready, but the preparations continue, and we hope we can finish many of you by month end. To date, based on our data, we have about 600,000 first doses from our healthcare workers that are due in November. And we are targeting about 1.6 based on the master listed, so the rest will come next month. No? So all the Bakuna registered health facilities, those with priority group, shall be utilized as vac sites and allowed to conduct vaccination activities. Similarly, what you did with dose 1 and dose 2, some of the hospitals opened their sites for their employees, no? And again, they will administer booster doses considering the allocation and the availability of the doses and the cold chain requirement and the capacities. Next slide, please. Just for operations concerns, so we will allocate the vaccines for booster to the region, and it will be the regional health offices that will be determining what are the requirements per area based on your attested master list, and they will be given depending on the priority brands and availability. And the other highlight is that we would like to again reiterate what Yusek Rosette was saying. Our primary consideration is still to finish our primary doses, no? So what we urge the different areas is not to redistribute the existing vaccines from their primary series to the booster series. They can use it in exchange, but be rest assured that they will be replenished. So we do not want to be hearing that they lack the vaccines for primary doses, because we have reserved them for the booster doses. And we'd like to emphasize our priority is still A1, we are already boosting. A2 and A3, they are the most at risk. So we do not want to compromise any vaccine allocated for them for the booster. We will have enough vaccines for the boosters. And the CHDs may allocate directly to our health facilities in coordination with the LGUs, and the LGUs likewise to do the same. Next slide, please. In terms of the vaccination process, the process will be the same. So this is the fixed site strategy, the standard operational processes. You are all aware of this, now the waiting period, the registration, maybe online or walk-in, but many of the facilities are already in the area where the health workers work. And then you have the health education and informed consent using the forms, and we have health screening. Health screening to screen whether you, again, to check whether you have received the 2 doses so that you will have a booster dose, and then our health screening for the current illness or the diseases or condition of the vaccinee, and our vaccine administration, and our reporting and our post-vaccination monitoring is same as usual. Next slide, please. That is for the fixed site. Can we have the next slide? So the member of the vaccination, this one now is informed consent, health screening. I already mentioned that. As a general policy, there should be another vaccination card for booster, and you can find the link in this bit.ly Resbacuna materials. There have been issues this morning that they may be using stickers, etc. We will be giving a complimentary advisory, what other forms can be given. What is important is you do the encoding so that these are back-cert ready systems, because in the end, what we will be really needing when the full DICT system works is we have a box certificate. No? So again, reiterating what Yusek Rosette was saying, you have a separate lane for primary dose and booster dose to avoid medication errors, and to please ask the age of the patient and whether they have their bakuna cards with them for the previous vaccination. Next slide. In terms of the reporting, all vaccination sites shall record the vaccination event. And we will have a quick counts on vaccination accomplishment and inventory to the boards daily. This is really for the administration side. And we have the required information of the vaccine recipients through a line list to the BUS line list upload tool within 24 hours after the vaccination activity. These are for the managers so that we have a visibility, what is happening, what is the inventory. Next slide, please. That's the line list template is updated to include a new column with the header for those who are managing the vaccination sites. No, we will have an additional booster dose, and submission shall be made through the portal at https://buslinelist.bic.gov.ph. Next slide, please. And the link to all forms for the booster doses can be obtained from this link. Maraming salamat.
Thank you so much, Yusek Mir Nakabutahe, for the very comprehensive presentation on the guidelines of the National Vaccination Operations Center for the COVID-19 booster shots. We would also like to recognize our speakers and other resource persons from our health experts. We have Dr. Edsel Salvano on the call, and Dr. Anna Bong Lim, and representative from the DOH family, Dr. Razel Nika Hao and Dr. Gabriel Borlongan. We would also like to recognize the participating medical societies we have in the call. We have Philippine Medical Association, we have Philippine Foundation for Vaccination, Philippine Society for Microbiology and Infectious Diseases, Pediatric Infectious Disease Society of the Philippines, Philippine Pediatric Society, Philippine College of Physicians, Philippine Academy of Family Physicians, Philippine College of Surgeons, Philippine Obstetrical and Gynecological Society, Philippine Society of Anesthesiologists, Philippine College of Radiology. And now to go to our open forum, we will be having a series of questions from our participants from the call as well as from the audience in our respective social media platforms. So we'll be starting our questions now. This question is for Yusek Rosario Singverhere, and the question po, Yusek, is bakit po natin inunanaw ang mga healthcare workers? Ano po ang ating pong rationale for this, Yusek?
Yes, actually, it's not really about vulnerability, no, because it was specifically stated that kahit sa WHO, sinabi nila, it's going to be the immunocompromised, the senior citizens, and the healthcare workers. Meron po tayong prioritization framework dito sa ating bansa, yung A1, A2, and A3. These are operational considerations. Unang-una, ang ating mga healthcare workers po, organized na tayo, no? We have our healthcare workers in our facilities. There would just be a few of our healthcare workers who are not related or affiliated with any institution. So, mas ma-facilitate po natin at mas ma-mobilize natin agad. The pangalawa, ang ating healthcare workers ang magbabakuna. So kailangan unahin po natin sila so that we can be able to go ahead and vaccinate the others, no? Karagdagang pagbabakuna po kasi itong gagawin natin for boosters. And then of course, the third would be that the healthcare workers will be more protected because they are at higher risk, no, when they are in the hospitals or they face patients. So that's why yung boosters po ay nairekomenda na mauna sila. But not to say na hindi po natin isusunod agad ang mga seniors at saka mga immunocompromised. Susunod na rin po. So our priority really for this booster and third doses are our healthcare workers, senior citizens, and those with immunocompromised states.
Thank you so much, Yusek. We have another question po for our tag expert. Maybe Dr. Edsel Salvana can answer this question po. Doc Edsel, the question po is, kung ang reaksyon ng bakunang pag-uusapan, ano ang pagkakaiba ng posibleng side effects ng homologous sa heterologous booster vaccination?
Yeah, thank you. Ang unang pag-aaral kasi dun sa yung different kinds of mixes, mukhang there is a higher risk of adverse drug reactions. However, hindi naman to severe. So it's really a question of yung harm versus yung benefit. And we know that yung benefit right now, we're still looking at the data. A lot of these are unpublished, not peer-reviewed. Kaya nga, naging parang executive decision to kasi if you guys remember, yung ACIP in the US actually did not recommend boosters for healthcare workers, pero in-overrule sila ng CDC. As we get more data, there seems to be more and more data that reflects some clinical advantage, not just antibody. Kasi yung antibody, alam naman natin, pag mag-booster ka, tataas talaga yan. That's natural for anything, but it doesn't necessarily reflect better clinical protection. Now, for instance, yung sa CoronaVac, we're seeing some data from Chile na yung protection from severe with any of the boosters is more or less the same, whether they used CoronaVac or Pfizer or Astra for that matter. Pero yung clinical protection seems to be higher, whether it's statistically significant or not. These are not peer-reviewed. For Pfizer, and the best actually is Astra. And that's part of the reason why ngayon dinagdag nga, di ba, the original release, hindi kasama yung Astra. So these are all moving targets. That's the most important thing. And because we recognize that healthcare workers are better to able to understand these nuances than the rest of the population, we are starting with A1 precisely because the data is not as solid as yung original randomized control trial data. And so the considerations here talaga are, number one, safety is first and foremost, and second is yung marginal efficacy ba, will it na improve, will it make a difference versus yung possible safety issues with heterologous vaccines. Now, we think that maybe for exposed frontliners, that might be worth it, pero kung healthcare worker ka na hindi ka naman super exposed, then you might want to go with a safer option, which is homologous. So those are decisions that need to be made on an individual basis, but we feel that it's already time for the healthcare workers to be able to decide if they feel that getting a booster, that's the first thing, whether the booster is needed or not. The data naman shows that protection from severe disease continues. Ang pinag-uusapan lang natin sa additional booster is increase in clinical protection. In other words, whether magkakasipon ka o hindi. If you think that is useful for you, then go ahead and take the booster. If you would rather wait for more data, then that is completely within your decision point as well.
Thank you so much, Dr. Edsel, for the wonderful answer regarding the questions on the possible reactions for the COVID-19 boosters. We would like to ask Dr. Ana Ongling naman po from our technical advisory group of experts po for this question. Doc Ana, efficacious pa rin po ba ang mga bakuna kahit nag-booster dose tayo ngayon? Paano pag hindi nakakuha ng booster dose sa prescribed period? Doc Ana?
So just babalik siguro dyan sa nabanggit kanina na ni Doc Edsel, no? Kaya nga sinasabi nating option ito. Kasi sa ngayon, ang data is starting to show, continues to show good protection against severe disease and risk of death. Pero yung protection against infection, symptomatic infection, yung medyo nakikita nating nagbabago. So, kung papansinin ninyo, parang nag-hedge ng husto, di ba? Ang tagal bago lumabas ng recommendations, hindi kaagad magkaroon ng global consensus galing sa iba't ibang health authorities. It's really because the data is still evolving. So anong mangyayari kung hindi ka mag-opt to vaccinate ngayon? Personally, I think there's still room to wait. Lalo na kung hindi ka naman sabak sa COVID wards araw-araw. Pwede namang, hindi naman madi-discontinue ang booster program, and in fact, mag-e-expand pa nga ito para masakop din yung ating A2 and A3. So wag siguro tayong kabahan na mawawala yung opportunity kung hindi na tayo pumunta ngayon na, no? Kaya nga yung wording ng ating recommendation is you have the option to choose to be boosted now, or if you want to wait later, that's also fine. I think the decision is really going to be hinged more on pag magpa-boost ba ako ngayon, gaano ba ka-safe yung aking pipiliin. Yun lang.
Thank you so much, Doc Ana, for the response po. We go now po to Yusek Mir Kabutay for the operation side of the implementation of the administration of the COVID-19 booster shots. And for this po, Yusek Kabutay, the question po is, how will the government choose which vaccine brands that will be distributed to a hospital or group of health workers?
At the outset, we have data on what were given to the different areas and ano yung inavail ng mga healthcare workers. Now we have that data, but this is more specific at the regional and the province level. They will ask the different regions ano yung kailangan nilang mga bakuna, and we will have enough. We have sufficient vaccines now to cover for these initial boosters for our healthcare workers. So it will be a two-way. From our side, we look at the data. From the healthcare workers side, may preliminary data, ano yung mga kailangan nilang mga bakuna, depende sa choice ng mga empleyado, but also depende kung ano yung capacity at the different sites. Kasi yung ultra-low freezer may not be available in hard to reach areas. So ano yung mga options nila? Thank you.
Thank you so much, Yusek Kabutay. In addition po to the vaccination sites that you were mentioning po, Yusek, meron po tayong question, and this is the question po, Yusek Kabutay. Dapat po ba same vaccination site where the primary series was taken ang pupuntahan for booster dose?
Preferably, para mas young and then you already know ano yung history. But we will be open to have vaccination for the booster anywhere as long as you show your previous vaccination card that you already had you have the 2 doses. And of course, a certification or at least an attestation or a recognition that you belong to the A 1.1 to 1.7.
Yusek Kabutay, another question po with regard to the vaccination of our A1 population. Hanggang kailan po ang target natin for this vaccination of the healthcare workers?
Kagaya ng sabi ni Dr. Ana, it will depend on the interval, no? So as was presented by Yusek Rosette and myself, no? May 6 months from the time na you finish the second dose of a 2-dose series or the first dose. Nag-iiba-iba, is a moving target. So as long as they are due, then we can record and we can give them their preferred vaccines if available. So it will be a moving target. Kagaya ng sinabi ko kanina, as of end of month, we have recorded mga 600,000 will be due for the second dose if they avail, and then the rest will be graduated. No, it's also a moving target. December and January we will continue as long as this is required from us. Thank you.
Thank you po, Yusek. I know this was already answered, ito pong tanong na to kanina, but siguro po another reiteration from you, Yusek Kabutahe. Ano po yung plano po natin for the booster dose ng iba pa pong priority groups? Meron po ba tayong plan for them na mabakunahan din po?
Yes, it has been presented by Yusek Rosette. This is a phased approach upon the direction and concurrence of the various experts group. Yung binigay niya na sequence, no? The healthcare worker is the first batch. We will now have a second batch for the senior citizen and a third batch for the immunocompromised. And the team of Yusek Rosette and my team are working now on the boosting the senior citizen for our guidelines. And then what specific immunocompromised conditions, the WHO lists 5, but we will need to check, no? Yusek Rosette Berhere is calling for the experts group to really drill down ano ba talaga ang kailangan natin gawin for the next priority group, A2 and A3. Thank you.
Thank you so much, Yusek Kaputay. This is another question naman po, but this is directed po to Yusek Rosette Berhere. Yusek Rosette, this is from Tita Sheila Vicente of one of our participants in the Zoom call. The question po, Yusek, is if with heterologous booster, full dose po ba ibibigay or half dose lang? Example, I was vaccinated 2 doses of Sinovac March and April. If I chose Pfizer as the booster dose, will full dose be given to me?
Yes, no? Yes, thank you, Jazz. Yes, ma'am, sir. Pag booster doses po, if it's heterologous or whether it be heterologous or homologous, yung dose po natin ay the same dose as with the primary series except for Moderna. Ang Moderna po for booster doses would just be half of that dose that you have received from the primary series. So pag tinignan ho natin yung department memorandum that was issued, the following volume shall be administered. Kapag Pfizer po, it's 0.3 ml. Ang Moderna po, it's just 0.25 ml. It's half of the usual dose. For Sinovac, it's 0.5 ml and AstraZeneca, it's 0.5 ml. So lahat po ay the same dose except for Moderna, which is going to be half of the dose which was originally given to our primary series.
Thank you so much, Yusek Rosette. This question naman po is dedicated for Dr. Ana Ong Lim. This question po is for Aldric Aguinaldo po and one from the Zoom chat po. Doc, how about those A1 members who are currently pregnant but wants to be inoculated with booster shots? What are the possible types of vaccines to be given, homologous or heterologous? In case it is heterologous type, is it safe for them?
Just medyo mahirap yung tanong na yan, ano, and I'm not shy about admitting that here kasi healthcare workers naman tayo lahat, and I'm sure you understand the quality of the evidence. Right now kasi, from what I recall from the CDC guidelines, wala akong nakitang special mention about pregnant, no? Pero coming from the perspective na ang pinoprotect natin dito is occupational risk, and considering na health na inactivated vaccines naman tong pinag-uusapan natin, I would not expect any issues with pregnant women receiving a boost. Now, siguro, on a personal note, I would probably advise homologous rather than a heterologous platform, just to decrease the variables and decrease the likelihood of any adverse reactions. I don't know if any of the other people in the panels are aware of any more updated data on this.
Thank you, Doc Anna. Doc Edsel, would you like to add?
Yeah, I think in the US they do recommend it, but they don't specifically state anything about homologous or heterologous. Sa atin naman A1 pa lang. So definitely kung hindi A1, I would probably not go for it yet. But based on the data kasi, lalo na for heterologous, ang konti-konti ng alam natin. And so I think this has to be a personal discussion between your OB and yourself. And also yung exposure. Kasi alam naman natin, tuloy naman yung protection against severe disease. Pero kung exposed, lalo na kung frontliner na pregnant, tapos more than 6 months na, then that's really a risk-based assessment. Kasi masyadong maraming unknowns rin for the boosters. So I think that is an evolving issue. On the safety side, kung wala namang significant exposure, I would probably wait for more data.
Thank you so much, Doc Edsel. Another question, Doc Edsel, lang po, directed po to Tab, and maybe ask your input po regarding this. This is from Helen Teves po, from our Zoom participant po. Good day from Sorsogon Province. Cited in my pre-vaccination evaluation that I have allergy to a specific antibiotic, which is mild. I received homologous Sinovac since that was my first available brand that time. If available, can I choose any of the 2 other brands other than the initial brand given to me? Doc Edsel.
Yeah, so the data for this is is not solid, okay? But we know that based on what IFE says, it is the least immunogenic among our immunogenic, meaning in terms of causing reactions, is actually the inactivated vaccine, Sinovac or Sinopharm. And their default really is kung may allergies, this is what they recommend. And maybe Dr. Bravo or somebody from the NAFIC can also talk about this. But as Ma'am Ana has also mentioned, the safest is probably a homologous vaccine. Lalo na kung may history of allergy, I would probably get the 3rd dose of Sinovac in this case.
Thank you so much, Doc Edsel, for the answer. We have another question, but this is directed to Yusek Rosette Vergere. Yusek Rosette, the question is from Jenny Ann De Jesus. Dear Yusek, just to clarify, does the booster prioritization include household members of healthcare workers? Similar question din po from Liz ng Facebook. What about relatives of the HCW living in the same house as A1 extension or yung A1 expanded population? Yusek.
Yes, no. So we understand that the family members of healthcare workers is part of the expanded A1. Pero pag tinignan ho natin, ang binigyan pa lang ho ng Emergency Use Authority ng Food and Drug Administration is for us to deploy or to provide boosters to senior citizens, healthcare workers, and to individuals with comorbidities. So yun pong expanded A1 natin for family members, hindi muna po natin sila bibigyan. We will just focus on these three sectors of the population first based on the EUA that we have.
Thank you so much, Yusek Vergere, for the answer po. We have another question po from Arnold Montero, but this is directed to Dr. Edsel Salvania of our technical advisory group. Doc Edsel po, the question is, will there be overdose when given more than the recommended dose, Edsel? Doc Edsel.
Yeah, well, the overdose here would be defined as more than what we recommend. And these are all immunogenic vaccines. So, the risk for adverse reactions, the risk for allergies, and other specific issues, like, for instance, they're having issues in young kids with the myocarditis with Moderna because it's 3 times higher mRNA vaccine than Pfizer. So we don't know is the answer. But in general, from a safety principle standpoint, you really want to give the lowest possible dose that you know is going to be effective, because otherwise you will increase the risk of reactions. So from a purely safety standpoint, we have to stick to these current doses. Kung mag-double dose ka or kasi right now our boosters are 1 dose right now, but we've heard of some people who already got their second course. We don't know what is going to happen to those people, or people who got a full dose of Moderna when they should have only gotten half a dose as a booster. The answer to that is I don't know what will happen to them. And that is why we always say, please follow whatever is being advised by the experts.
Thank you so much, Doc Edsel. We have another question po for Yusek Mirna Kabutahe. Yusek Kabutahe, the question po is, kung sa ibang bansa po nakakuha na ng primary vaccine doses, pwede po ba dito magpa-booster? Hindi na po siya babalik abroad?
Yes, they are due for the booster, and they belong to the priority group that have been enumerated.
Thank you. Thank you so much, Yusek Kabutahe. We have another question po for Dr. Edsel Salvania po. Dr. Edsel, the question po, if there are immunogenicity concerns for vector-based vaccines, why is AstraZeneca still recommended as a booster dose for those who got the AstraZeneca vaccines initially?
Right. There is a theoretical risk na if you get a third dose of Astra, your body already has preformed antibodies against that third dose. There is one study that says that this doesn't seem to be the case. It's really more of a theoretical risk. So, kasi when we're talking about boosters, there's really just 2 things we're talking about: safety and efficacy. From a safety standpoint, there doesn't seem to be any problems with the third dose of Astra. The question then becomes efficacy, because if people make antibodies to the ChAdOx carrier, to the adenovirus carrier, by the third dose, those might be significant and hindi na madi-deliver ng adenovirus carrier nung viral material into the cell so that it can induce an immunogenetic. It's a theoretical possibility of decreased efficacy. In which case, kung ganon, kung may choices ka naman, and it's not a safety issue, it's probably better to pick something else. This may also hold true, again, theoretical, with the other adenovirus vaccines like Janssen and Gamaleya. In fact, yung Gamaleya nga, magkaiba yung ginamit niyang adenovirus for the first and the second dose, precisely because takot na takot sila dun sa preformed antibodies against the adenovirus. But some of these antibodies can cross-react across adenoviruses. So there is an efficacy issue, albeit theoretical. But if you have an alternative which you know will be immunogenic, it's probably better to go with that. But it doesn't completely rule it out. This is really more of a caution which has a theoretical basis.
Thank you so much, Doc Edsel, for the answer po. Doc Ana, we have another question po for you. The question is from Michelle Simpas, one of our Zoom call participants. Is it safe to boost before the recommended 6 months timeline?
Alam nyo, yung basis kasi ng booster is really naka-base siya dun sa understanding natin ng antibody responses. And there is such a thing as optimizing, no, these responses. And from what we know right now, the data supports boosting on the 6-month onwards. Ito rin yung nakikita nating recommendations na ginagamit natin para dun sa mga dating bakunang binuboost natin. So, siguro dahil the state of knowledge that we have for these vaccines is so recent, let's try to stay within the guidelines para hindi rin tayo masyadong magkaroon ng unforeseen na consequences. So bottom line, better siguro to wait until your 6th month before reporting for your boosters.
Thank you so much, Doc Ana. We'll be having last 2 more questions po. And second to the last question po is for Yusek Nir Nakabutahe. Yusek Nir Nakabutahe, this is more related on the operation side of the implementation. Kakailanganin pa po ba ng mga medical certificate para po doon sa mga immunocompromised po na ating po mga babakunahan?
Definitely, we will need a medical certificate for those who are immunocompromised. We have not yet finalized our guidelines for the booster for immunocompromised. But what we usually do is dedicate special units where they can be vaccinated, no? Kasi may mga minomonitor natin, like yung mga HIV count nila, yung mga under radiotherapy, chemotherapy, cancer. So they will require certain clearance from their attending physician, and we will try to limit certain areas where they can be vaccinated. Thank you.
Thank you po, Yusek Abutay. We have last question po from Metropolitan Aida Muniz. This is for Dr. Edsel Santana. Dr. Edsel, the question po is, how long will the protection of the booster shot last?
Yeah, the answer to that is no one knows, because this is going to be a prospective thing we have to see. And also, we're actually not even sure just how well these boosters are going to work. And that's why siguro we need to emphasize that this data is nowhere near as good as the RCT data that we have for the primary series of our vaccines. Kaya lang linalabas ito as an option because there is some data that is showing that there may be waning of clinical protection, particularly against mild disease, after 6 months. But the protection against severe disease remains. So ang pinag-uusapan lang natin dito is potentially a marginal increase in protection against clinical disease. And if your risk is high, if you're in A2 or A3, or your exposure is high, A1 na frontliner, then we are giving the option. Pero walang sapilitan to, precisely because we don't know what is the added protection versus the potential risk of side effects with either homologous or heterologous vaccines. So even before we ask how long will these boosters last, the first question is, do these boosters really work? And the data is pointing that it might work, especially for a subset of patients. But at this time, even the US CDC says this is not for general population because hindi pa tayo certain sa benefit. We're only looking at special risk populations because there is a potential benefit. but there is no guarantee there will be benefit until we get better studies. And so, the first message is, number one, pag-isipan nyo na mabuti kung kailangan nyo talaga ng booster. Kasi if hindi naman kayo highly exposed, hindi naman kayo kasama doon sa vulnerable population, then it's probably better to wait for better data because your protection against severe will continue. You already got the benefit from the primary vaccination. And if you want a booster, hindi ko magagaranti na that's useful, and hindi ko rin magagaranti na there won't be a bad side effect. So right now, we are offering this as an option, understanding again that A1 can decide for themselves and that the data is not great, but there is some data, and you can decide whether you want it. Walang sapilitan to. And again, try to think about your own personal circumstances, whether it's worth the risk, and what will you think will be best for protecting you. Thank you po.
Thank you so much, Doc Edsel. Doc Ana, I saw your hand raising po kanina.
Yeah, I just wanted to support what Edsel said, no. I think people naman recognize the difference in the tone of the recommendation now compared to the tone in the previous town halls that we had when we were talking about primary immunization. Yung primary immunization, tipong kulang na lang puntahan namin kayo sa lugar ninyo at bakunahan na namin kayo ngayon right now, di ba? Pero itong boosters, medyo isipin nyo ng maigi, consider your risk, consider your health status. Kasi the data nga is still evolving. Pero dahil nandito na nga tayo sa punto na marami na rin sa atin ang nakalampas dun sa 6 months from our second dose, syempre tama din namang i-offer as an option kahit yung data ay evolving sa ngayon. So siguro, just to pick up on another point that Doc Edsel mentioned regarding special populations, actually yung paggamit natin ng word the booster parang nahalo na dun sa konsepto ng third dose eh. Kasi kung titignan natin yung mga medyo may firm recommendations, it's really directed towards immunocompromised and senior populations. And for that, maganda-ganda ang data. So siguro kung A1 tayo at nabibilang doon sa mga grupong yun, those groups, we would encourage na please avail of this opportunity now kasi mukhang kakailanganin nila. Thank you.
Thank you so much, Doc Ana. Before we have our closing message po from our Undersecretary Yusek Vergere po, we'll be having few messages lang din po from our panel po. Let's start po with Doc Edsa Salvana for your final reminders din po, Doc Edsa.
Yeah, I think I already mentioned nga that again, this is a choice. This is a courtesy that is being extended to healthcare workers precisely because we rely on healthcare workers, and we understand that healthcare workers are properly equipped to understand naman what the state of the evidence is. So in terms of making the decision, we leave it up to you. And I think that as has been mentioned by Yusek Mirna and Yusek Rosette, our primary purpose pa rin talaga is to get as many people vaccinated in terms of their primary series, and then think about whether you need boosting based on your risk profile. But whatever happens, the science continues to evolve, and we will continue to evaluate it and give you what we have so as to help you make these decisions. Thank you very much.
Thank you so much, Doc Edsel, for your final reminders. May we ask also Doc Ana Olin for her few words po?
Siguro yung babanggitin ko lang is in the rush to provide boosters for the different populations, wag sana natin kalimutan na ang focus pa rin dapat is sa A2, A3. And marami pang lugar sa Pilipinas na hindi pa optimal ang coverage ng A2 at A3. So, nababanggit ko na kasi before, kung ang goal natin for boosters is to improve protection for those who are already vaccinated, hindi lang ito ang tanging strategy para makabawas sa infection. Kung nababawasan natin ang mga bilang ng taong may sakit sa paligid natin, tulad na rin yan ng proteksyon na makukuha natin kung magpapaboost tayo. So, because mababawasan yung exposure ng mga bakunado na. So I think even as we are starting to consider boosters for special risk groups and special groups who are exposed, let's not forget to continue our work with our A2 and A3 and encourage their vaccinations too. Thank you.
Thank you so much, Doc Ong Lim. And maybe we could ask also final reminders din po from Yusek Mir na kabutahe sa ating pong mga healthcare workers na mag-start na po magpa-booster ngayong araw na ito. Yusek Mir, no?
Salamat, tatlong bagay lang. Unang-una, salamat sa interest and your participation na halos hindi daw ma-accommodate sa dami ng gustong mag-attend sa town hall. And also, we'd like to thank all the frontline health workers, all of you, for your continuous work. No? Alam ko pagod na tayo, but we remain to stay alert and really unite to help fight the COVID problem. Number two, I receive many requests for the slides kasi yung iba daw hindi marinig and then the others were not able to participate. So at the end, they will tell you kung ano yung link so that you can avail of the slides. And then number three, I know there are many questions that we are unable to answer. We will just request Jas and the team of USEC Rosette. Iba to sa amin yung mga pwede naming sagutin, tapos sa kanila yung mga kailangan na sagutin, no? So that hindi naman sayang yung pag-participate nyo and we were unable to answer many particular granular questions. Again, thank you and please remember the short messages of our two TAG members and then the final message of USEC.
Thank you po, Yusek Kabutahe. And to give us a final message po for this town hall on COVID-19 boosters for our A1 population, I give now to you our Undersecretary of Health for Public Health Services team, Yusek Rosette Sinberhead.
Yes, thank you, Jas. Unang-una po gusto ho namin magpasalamat sa inyo lahat for attending this town hall event. And hopefully, we were able to equip you with some information and we were able to clarify yun pong mga pag-aagam-agam o kaya ay mga katanungan nyo po. Gusto rin ho namin magpasalamat sa aming mga eksperto na sinamahan kami ngayong araw na ito, Dr. Ana Ong Lim and Dr. Edsel Salvania from our Technical Advisory Group of Experts. Wala man po sila dito, gusto pa rin ho namin magpasalamat sa iba pa ho namin mga eksperto na kasama po namin bumuo na mga pag-aaral na ito at kasama ho namin nakikipag-usap and discussing regarding these recommendations to the Department of Health. Our NITAG experts, our NAFIC experts, our HTAC experts, and our vaccine expert panel from the DOST. Maraming salamat po. And of course, thank you very much to Yusek Mir Nakabotahe and her team for attending with us and also explaining the operational considerations for this booster or third dosing that we are going to do. Gusto ko lang ho mag-iwan sa inyo ng mga paalala, katulad po ng mga paalalang binigay ng ating mga eksperto. Unang-una, boosting is voluntary. Hindi po ito required, hindi po minamandato sa ating mga healthcare workers. As long as you have already gotten your primary series o yung 2 doses nyo po ng inyong bakuna, you are already considered fully vaccinated. So again, let me reiterate, voluntary po ito. That's why we are giving you options and that's why we are explaining all of this to all of you today. If you have decided that you will get the booster, government is offering Sinovac, Pfizer, Moderna, or AstraZeneca as booster doses for our healthcare workers. Meron po tayong present kanina na mga konsiderasyon para kayo po ay makapagdesisyon ng mas maayos, whether it be homologous or heterologous booster doses that you would be choosing for yourselves. The current guidelines na inisyu po natin ngayon, mag-uumpisa po tayo sa healthcare workers. And there might be some minor changes as we roll out to our senior citizens and for those with immunocompromised states. So we will release further guidelines para po sa senior citizens and those with immunocompromised states. And we will also conduct a similar town hall para mas maliwanag din po sa mga sektor na ito, and we can also help clarify certain questions coming from these sectors. So the Department of Health remains committed in supporting and protecting our healthcare workers. Katulad po ng sinabi na ni Yusek Mirna, kami po ay nagpapasalamat sa inyong lahat. Alam po namin na magdadalawang taon na po tayong lumalaban dito sa COVID-19, and we would like to afford you with protection na kung na pwede nating maibigay sa inyo kung sakasakali. But let me just reiterate, whatever vaccines you have right now, it's still working for you, and this booster dose is voluntary. So makakaasa po kayo sa aming suporta sa entire period nitong pandemic and even after the pandemic na ang Department of Health ay lagi nyo pong kasama sa atin pong pagtatrabaho para po sa ating mga kababayan. So let us just try to continue to protect ourselves, our family, and community by adhering to the minimum public health standards. And please help us in advocating to our communities, to your patients, for those who have not been vaccinated yet and are already eligible, specifically the A2 and the A3, please help us that they be encouraged to be vaccinated already so that we can have more protection in our population. So maraming salamat po uli. Thank you very much, Jazz, and take care all of you.
Thank you so much, Yusek, and to everyone, maraming salamat din po at magandang araw po sa inyo.